It's worth knowing a little bit about the history of informed consent to provide some context for what's currently considered best practices. So, consent as we know it today really arose largely out of the 20th century, galvanized by unethical research practices that started gaining public attention. This helped propagate the idea, policies, and laws that people have the right to participate in decisions about their health rather than paternalism, where clinicians are assumed to know what's best for people and tell them what needs to happen. This led to a series of landmark legal cases in the 20th century where courts were really challenged to define informed consent. What is material information that must be discussed in order for someone to make an informed decision? Now, previously, this was largely based on what was called the reasonable physician standard. What would the average physician in a given field tell someone about the risks and benefits of a potential intervention? That's now been shifting to what's called the reasonable patient standard. What would the average person expect to be told about the risks and benefits of a potential procedure in order to make an informed decision? This is relevant because it brings in things like an individual operator's experience might be considered material information under the reasonable patient standard, whereas that may not have been considered under the reasonable physician standard. The other big shift is that most recently, shared decision-making has become increasingly accepted as the ideal approach to informed consent. With the rise of patient autonomy, in contrast to paternalism, there was also concerns that it also isn't necessarily right to just defer to whatever the patient wants. Many patients don't have a formal medical education, and part of our duty as clinicians is to be a source of information and provide a recommendation. So the idea of shared decision-making is that we should, yes, be sensitive to patients' preferences, but also provide guidance and recommendations. Think of it as a kind of balance between the extremes of paternalism and just deferring to whatever the patient wants.